to this week's office hours for ESG and ESGCV. My name is Kimberly Simpson and I am today's moderator. If you are just joining us, please go to the chat and introduce yourself with your name and the region you represent. As a reminder, this office hours session is being recorded for public record. A copy of the slide deck and recording will be emailed to all attendees. Next slide, please. How to ask a question. All questions must be submitted in the chat box. Please type your question into the chat box. The team will read questions out loud at the end of the presentation and will provide answers if possible throughout the presentation. All questions and answers entered into the chat box will be recorded as part of the public record. Alongside our presenters, we also have several HCD staff, including ESG representatives, ESGCV grant administrators, and other consultants who are able to answer questions during the Q&A session. Next slide, please. Today's office hours session agenda includes ESG and ESGCV updates, office hour updates, upcoming trainings, ESG and ESGCV questions and answers, and our spotlight session today, which is homelessness prevention models and best practices. And now I will turn it over to Sarah for our ESG updates.
Thank you, Kimberly. Next slide, please. So just going to recap on the NOFA applications. The applications were released June 13th. They are due August 17th. You can find the information on our ESG homepage. Reminder that, and this is for all applications, that in order to meet the threshold requirement, you have to submit all documentation by the due date. If you have any questions, feel free to email us at esgnofa@hcd.ca.gov. Next slide, please. Sorry, go back one more. So for annual contracts 2020, the expenditure deadline has passed. It was July 7th. Make sure that you get your final request for funds to your ESG representative no later than August 24th. This is to give us ample time to process all requests and to get you paid. If you are done expending, please submit the completed certification of closeout form to your ESG rep so we can get those contracts closed out. 2021 ESG contracts, the standard agreements for the balance of state are going to be executed no later than the end of August. If you still have pending correction items to return to us for the balance of state applications, non-competitive or competitive, you have to complete those and get them back to us by the end of July in order for this to happen. Otherwise, remember, we cannot give you a standard agreement until we have all documentation. For contracts that are already executed, because we do have 15 that are executed for the continuum of cares. Remember, there are expenditure milestone deadlines. So the first one is coming up. It will be 120 days from the execution date of your contract. So avoid that recapture and make sure that you are expending your funds. We have to have that first RFF from you with that 20% expenditure milestone no later than the 120 days from execution date. Next slide, please. And of course, our ESG webpage. If you have not visited our webpage, make sure that you do click around on the different icons. There are some trainings and additional resources. Next slide, please. ESG policy documents, we're going to keep hitting home with these. Make sure that if you have not already done so, check out all of the different policy guides that we do have. especially the newer version of the ESG BAWA compliance policy and ESG equipment acquisition and disposition policy. Next slide, please. APRs. They're required for all open contracts. The expenditure, the reporting period is July 1st of 2021 through June 30th. Your ESG representative had emailed you all of the workbooks and the instructions. Next slide, please. If you have not already turned in your projects, it is extremely important that you do so. The reporting team is also waiting on quite a few CSV uploads. So if you are having issues, please make sure that you email the ESG NOFA inbox as soon as possible so your ESG rep can get back to you and troubleshoot what is going on. The APR workbooks and APR cost workbooks are all due by August 1st, which is Monday. Remember, if you are coming in under the balance of state competitive for the 2022, you can be docked points and will be docked points if you have a late or missing APR. Next slide, please. And of course, your ESG team members, got Diana Prado, Giovanni Martinez, Tuesday Cool, Sam Liu, and Anthony Zepeda. So if you have any questions, please reach out to your rep, or you can contact us at esgnofa@hcd.ca.gov. Thank you. Next slide.
Thanks.
And back to you, Kim.
Thanks, Sarah. And now for the ESG CV updates. HCD is now ready to start amending ESG CV contracts to extend the contract expiration date from September 30th, 2022 to the new date of December 31st, 2023. Emails were sent earlier this week to all ESG CV grantees. The next step would be for subrecipients to submit a contract amendment in eCivis. Instructions on how to submit a contract amendment have been emailed to you by your grant administrator. If you did not receive that email, reach out to your grant administrator to make sure that you get it. Please submit this amendment as soon as possible. Email your grant administrator for any questions you have. Next slide, please. The new term of agreement and performance milestones are as follows. The agreement will expire on December 31st, 2023. All program funds for projects, street outreach, emergency shelter, rapid rehousing, and homeless prevention shall be expended by September 30th, 2023. All funds for HMIS and administrative costs shall be expended by October 31st, 2023. All final funds requests shall be submitted to the department by November 15th, 2023. New expenditure requirements. In accordance with HUD's expenditure deadlines included in the CPD 2206 ESG CV notice, grantee must meet the following expenditure deadline for ESG CV funding. Should the grantee not meet the following expenditure requirements, HCD reserves the right to recapture any unspent ESG CV awarded funds up to the maximum amount listed below. Next slide, please. Just some things to keep in mind. You cannot submit an RFF in eCivis after July 30th, 2022 if your current contract has an expenditure deadline date of July 30th, 2022. Some communities have already received an amendment extending their expenditure deadline for, past 9/30/22 and contract expiration date 11/30/22. So those communities do not fall under the 7/30/22 RFF deadline. Once your contract amendment is executed, then you can submit your next RFF. If you have extenuating circumstances and need to submit an RFF while your contract amendment is being processed, you must inform your grant administrator and receive written approval from HCD to submit a RFF before the contract amendment is executed. You cannot submit an RFF with expenditures past your current expenditure deadline date in your most recently approved executed contract. See Exhibit A for the exact date. Next slide, please. Upcoming HCD's office hour updates. Our upcoming topics. August 3rd, 2022, preparing for a COVID surge. August 10th, 2022, invoice review clinic. August 17th, ESGCV outcome measures. And August 24th, cultural humility. Training site to register. Someone is going to drop it in the chat for you all, and it'll also be included in the email that we send you. The ESG office hours YouTube channel link will also be sent to you all. Next slide, please. Upcoming trainings for the remainder of July. Today from 12 to 1:30, we have the community workshop, equal access rule, small group session 5. July 28th, from 11 to 1 p.m., we have the impact of race, understanding internalized racism, racial equity foundational series. Someone's going to drop the link into the chat for the trainings. This link will also be sent to you in the email. And also the link for the previous trainings, visit HCD's ESG workshop and trainings. That link will also be sent to you all. Next slide, please. And this is a list of COVID response resources. Next slide. And this slide has our ESG resource links. Next slide. And are there any questions? Let me look in the chat and see if I see any questions. All right, so no questions so far. If you have to contact us, if you have any further questions, please contact your annual ESG rep, or you can email them at esgnofa@hcd.ca.gov. For ESGCV, please reach out to your grant administrator. And now I will hand it over to LaQuantia, who will be introducing the speaker for the Spotlight Series presentation.
Thank you, Kimberly, and thank you, Sarah, for the updates. We will now have Mr. Tom Albanese with Homelessness Prevention Models and Best Practices for our Spotlight Series.
Great. Thank you so much. Can you see me okay?
Yes.
Okay, wonderful. Good afternoon or good morning, everyone. I'm in Eastern time. It's actually afternoon where I'm at. I'm Tom Albanese. I'm a licensed social worker on the ICF team, a contractor working with ICF to help providers around the state with ESG CV implementation and also best practices. Just by way of quick background, I've been providing homeless services or otherwise working with communities and providers to stand up homeless services for a little over 30 years, and started in the early 90s running a small rural shelter and standing up transitional housing and street outreach and homelessness prevention in rural communities, and then relocated to Columbus and worked in the Columbus, Ohio system for many years, and then did a lot of national work with federal programs and may have crossed paths with some folks here. So I'm excited to be here today. Aaron and Chris and others on the ICF team had asked if I would speak to homelessness prevention models and best practices. I've spent a lot of time in my career, especially in recent years, working on homelessness prevention systems and best practices, and really getting to targeted homelessness prevention Many of you are familiar with that. I'm going to spend a little bit of time just in a moment going through just level setting on some basic concepts. But then I want to talk about, what are we doing? What are we learning today in the prevention space around best practices and approaches to getting to the right people at the right time with the right support. So that's what we'll talk about today. I want to encourage folks. I know probably many of you sit on these office hours and might multitask. Obviously, I hope you're here because you are also interested in just, continuing to dive into prevention and learn more about it. But I'd encourage you to use the chat, drop any thoughts, any reflections, any of your own experience or questions into the chat as I go. I'll try to keep an eye on it. I'm sure LaQuantia or Aaron and others will help me, kind of pull forward things. Don't hesitate, any of our folks on the ICF side to interrupt me with, so-and-so has a great question if I miss it. Next slide, please. So why do we care, about preventing homelessness? This is stating the obvious, I think, to many of us know why this is so important is we need to move beyond crisis response strategies as sort of the primary way to respond to homelessness and both sort of rehouse people more quickly, more successfully, even in tight, extreme housing markets, and prevent homelessness. As somebody used to say, we need to turn off the tap as we're opening up the drain to kind of let the bathtub, drain out. And which is maybe not a great analogy. We're talking about real people, but this graphic also kind of gives that same idea. And this is where a lot of communities are starting to turn to prevention and really getting serious about prevention as a way to start to reduce inflow and the stress on systems while we continue to make sure we have enough emergency responses and more accommodation and supports or rehousing assistance for people who need it so we can reduce that time and get folks stably housed as quickly as possible. Next slide, please. There are some common elements to just effective community-wide approaches to preventing homelessness. Of course, I think it's the most immediate benefit, for a community is that we can in these times is to make it clear that this is a public health strategy. This is about reducing harm, both for people who might experience homelessness and our neighbors, right, who might also cause to be exposed. It will obviously reduce the number of people experiencing literal homelessness and help to reduce the demand on a system. It'll allow us to better use our limited resources. And when we do it effectively, we can do it in a way that allows us to quickly connect people to other community assistance they may need for ongoing stabilization support. I'll talk more about this in a minute. But what effective approaches don't do is they don't solve poverty by themselves. They don't solve the growing, lack of affordable housing and other things that get in people's way, like racism and inequity that are buried and fully baked into a lot of our housing and other systems. So prevention practices don't solve those things. So that reality check is really important, not because we don't know that, but just sort of reminding ourselves that partnerships and doing what we can within our kind of scope and our latitude is always where our focus should be, and then advocating for more solutions more broadly. Next slide, please. There are some really quick key concepts. I always share these when I talk about prevention, even though it feels like so academic and so forth. And for those of us who are like in the work, rolled up sleeves and so forth, it feels far removed. But it's really important. We just all have the same appreciation for when we're talking about preventing literal homelessness. We use every word very intentionally. We're not talking about preventing housing instability. We're not talking about eviction prevention. We're not talking about preventing somebody from having to go stay with a relative or sleep on a couch. We're talking about preventing literal homelessness as our first priority. And certainly with ESG dollars, it's a requirement that's who we focus on. It has to be targeted. And so we should consider, are we efficient? Are we getting to the right people, in our approaches? I'm going to talk about how we do better targeting, how we can get to the right people. And then are we effective? Once we get to the right people, can we actually prevent them from becoming literally homeless? And this is all sort of based on some work that fabulous, leader in our field, Marty Burt, put together for HUD, and it still rings true today, these concepts. Go to the next slide. Let's talk about that now in the context of, more broadly speaking, homelessness prevention. And when we sort of think about homelessness prevention, just again, it's important that we have a bit of a finer understanding. I see your question, Carl, I'll come back to it. That we have a little bit of a finer understanding that, all prevention isn't the same. Somebody said to me one time in an SSVF training, she came up after me afterwards, she said, oh yeah, me and my team just finally clicked with us. We're like, oh, eviction prevention is not the same as homelessness prevention. And I was like, boy, that is just a perfect way to state it. I always share her comment. But it is about distinguishing, types of prevention that are primary, that are kind of earlier, they intervene much earlier before somebody's on the cusp of and really is clearly going to become literally homeless. They might be about helping somebody with paying off rental arrears, dealing with the utility shut off, otherwise avoiding eviction. Yeah, Marty Burt. Avoiding eviction and staying in their home, but they weren't necessarily going to like sleep in their car were they not evicted. That's what primary eviction kind of focuses a little bit more upstream, not at those most precariously housed folks who are about ready to teeter into a shelter or the back of a car or somewhere unsafe. Secondary prevention is really targeting, getting more at folks who are at higher risk of homelessness. And then there's tertiary prevention, which is really important. And oftentimes we don't talk about this, but this is, the types of things we help people with once they've experienced literal homelessness and now are housed, and we're trying to help them not fall back into literal homelessness. So tertiary homelessness after the fact. And these are all part of secondary and tertiary homelessness, are really targeted, and they're largely similar. But that's a really important kind of grounding concept. We go to the next slide, and then I'll come back to some of the comments in the chat. Just to tie it out. This is where targeted prevention sort of fits in. It's a type of secondary homelessness prevention that's very specifically targeted to households who have become literally homeless. That means, per what we understand literal homelessness to be, within 30 or sometimes 14 days, that's the ESG requirement for some of their criteria, or less, but for your timely intervention and assistance. That's what targeted prevention is. If you don't intervene, this person will, you can see the path. They're going to be in home in emergency shelter within the next few days or few weeks. And this is about, again, a very specific type of prevention. And it requires us to do things differently than we're maybe used to doing as an agency or as a provider. If you administer EFSP dollars, FEMA dollars, if you administer other rental assistance dollars, you may not be so used to the types of approaches I'm going to talk about. Let's go to the next slide, and I'm going to look at what I've got in the chat really quick. Carla says, currently working in housing navigation, but we transition. Great, thank you. Thank you, Carla. Yep, Robert, Marty Burt is awesome. Sorry, keep those comments coming. Shout out to Marty Burt. So this, I wanted to tie that academic, kind of piece, level setting really quick to more on the ground, like, what does this matter to me, in my daily work? Well, these are the eligibility criteria for ESG that we all have to pay attention. If you're using $1 of your ESG funding, whether it's annual ESG or ESG CV for prevention, you have to adhere to HUD requirements, right? And so these are the specific ESG CV requirements that are in place in California for at least ESG CV dollars funded through the state that fund prevention, right? So you can serve people who are imminently at risk of literal homelessness. And there probably should be a word there, literal homelessness. That's really what it means. It's what HUD's intent is. And these are people who are losing their nighttime residence within 14 days, and they have nowhere else to go, and they lack other resources, right? It's kind of as simple as that. And but it's not as simple as that. It's actually much more complicated than that. And I'll talk about that in a second and why we should worry about that, but maybe not as much as sometimes we do. Category 4, if you're fleeing domestic violence, you're categorically eligible for prevention. You're also categorically eligible for shelter. It's an unsafe housing situation that is self-evident, requires, another option. And then there are other sort of risk of homelessness criteria that HUD has. They call them their at-risk criteria. And at-risk criteria are what you see here on sort of the right panel. Very similar to the category 2 imminent risk of homelessness definition, which is actually category 2 of the homeless definition to make it really confusing. They're very similar types of things, but I'm not really here to talk about how you adhere to HUD requirements. My presumption is you are, or you will, if you're doing prevention work, but I wanted to connect some dots here. And the reason, if you go to the next slide, the reason I wanted to tie this to the regulatory requirements of the ESG program, other way on the slide, thank you, is it really boils down to this big question. This is the most fun, if particularly, I'm sure some folks here, frontline folks, but probably a lot of supervisor, program manager types, I imagine, is you're working with your staff. This is the most important kind of concept just for them to grasp as they step into this work, especially if they're new, right? This isn't like a new concept. And this is really hard. It can be very difficult. I'm a licensed social worker. I know personally it can be very difficult to be in a program where you are kind of zeroing in on a very specific at-risk population and others who may be also at risk, but less so, or maybe more upstream slightly. They got a little bit more time, or maybe they could fall back on their relatives, but all those situations suck anyway. And as a good social worker, you want to do something. It'd be difficult to kind of work into this space, but it's really important that we do, and that we are making sure we've got good partnerships. So we're never saying no to anyone. We just might say, we're not actually the best program, let me get you connected somewhere else, right? And that's kind of a fundamental obligation of a good homelessness prevention program. But this is really the key question that I think is really reflected in the most simplest way. Oh yeah, thanks, Aaron. Yeah, your eligibility clinic. So if you go to the next slide, let's just go now into a little bit more of the practical kind of application of all this. So this I share, there's a couple clicks here that this slide will show a little bit more information. Let's just click show it all. Aaron, if you don't mind, if you're controlling the slides, stay on the slide, but yeah, just think that is it. That's it. So this is a lot of information, right? The reason I share this is because it's tying back to, not everyone who is housing unstable, who's facing housing loss, has the same urgency or risk relative to becoming literally homeless. A lot of people, in fact, a large and much larger number of people annually or on any given day are housing unstable than those who will become literally homeless on any given day or over a year. So there's a big universe of very low income, no income households who are living, check to check or month to month or scraping by day to day, who are not tomorrow or within 14 days going to be literally homeless. If they lose their housing, they might, in fact, many often do, as I think all of us can appreciate. We've all done this. I've done this myself. Falling back in family and friends when you lose your housing. And distinguishing households who have a network, a support to fall back on versus those who don't, who are also facing housing loss, is a really important dividing line. Because people who have someone to fall back on or have some of the resources to use or access is a really big universe. And that universe, we can use our tiny little pot of ESG prevention dollars, and we can burn them up in a week to the extent we're serving people who are just housing unstable, maybe not imminently at risk coming into the system. We want to make sure those folks get help, they get connected to other resources, ideally blended and through your shop, so they don't even know what's happening behind the scenes. It's all just, seamless. But in the event that it's not you, you've got a handoff. But otherwise, focusing in on those households who are really most at risk and providing targeted prevention to those households. And there's very different characteristics. I want to just point this out of households that are imminently at risk. Within 14 days, even up to 30 days, I would say 14 days, because the less time that remains, the more sure you can be this person is truly going to be literally homeless if you don't intervene, because those other options become more clear that they're not actually available versus, things change over time, the more time you have. That being said, households who are really in that most imminent risk category, it's a small subset of people who are housing unstable. They tend to already be in doubled up situations. If you look at your shelter system data, I'm sure many of you have, but if you haven't done that yet, ask your COC. If you are the COC, pull out your prior living situation data or ask for a special report on that and look at where people are saying they were the night before they entered shelter. Ideally, people who are newly homeless, to focus on them, so you're not commingling people who are maybe cycling in and out, who are, just not getting any traction. But if you look at newly homeless data, you'll almost universally find that households who are newly homeless, the last place they stayed was not an apartment that they had a lease for. The last place they stayed was a friend or relative's house. Not everyone. A lot of people do have, they get evicted and they got nowhere to go and they need shelter, of course. But most people do come from doubled up situations because they use their networks, of course, if they can, if they're available, if they're safe, if they're, welcoming and so forth and affirming, if they're there. And so that's a big clue for us. That's a big clue for us as to where we start to focus our targeted prevention resources and the partners and the community folks that we might need to start talking with if we're not already. So as soon as you start to look at the types of housing situations people are in, that'll start to inform, I think, your strategy and some of the readiness you may need to have. But again, most folks are in doubled up situations when they're at this most precarious state. They, of course, will, they are categorically, if you're screening correctly, they're not going to have any other resources or very little other resources. They'll have really nowhere else sort of permanent they could stay. And if you're really getting to the most at-risk folks, these are also folks who probably they've exhausted any friend or relative they could stay with. They are really at the end of the rope, at least from their perspective as they're presenting. But this is where, and I'll say this too, as I think many of you probably know, a lot of folks who are in those situations, they're not necessarily showing up at the front door of your homeless system or asking for rental assistance or anything like that, because they may not know where to turn, or they may not yet feel they have that need. They're just trying to scrape by day to day. So how do you get to those folks? And we're going to talk about that. But I will say that if you consider this, kind of dense graphic altogether, you'll, I hope, have a clear kind of conception of like, where does homelessness prevention fit, and specifically where does targeted homelessness prevention fit, and how does it fit vis-a-vis community prevention resources, and kind of, what role does it play, and where does it fit vis-a-vis the homeless system? And so this is a piece I want to make sure we're all really clear about when we talk about standing up targeted homelessness prevention. Not only we want to look at our data and start with what we can see and where people are saying they are, so that's a big clue for us, but we should also start at our front door. People who are concerned enough to be reaching out or asking for emergency shelter, whether it's through 211 or through your coordinated entry system or your first contact at an access point, anybody who is being initially screened as asking for or seems to be in need of emergency shelter. Of course, I think many of you are probably now doing diversion, problem solving immediately with those households to try to prevent or forestall need for shelter. But that problem solving oftentimes is helpful for like immediate, kind of figuring out an immediate solution tonight, maybe for a few nights, maybe for a few weeks. But oftentimes there's a need for a baton and another, kind of next step resource to pass to. This is the perfect place to position and start your targeted prevention, because households who presented for shelter who could be diverted and who also remain imminently at risk, right? So it's a slightly narrow, not just everybody who's diverted, but people who are diverted and still remain at high risk are the perfect group to focus in on for targeted prevention and to start that next stage of developing our targeted approaches and bridging them with community resources. So we have, again, kind of a no wrong door community model for prevention that's integrated and connected to the front door of our crisis response system. So go to the next slide. I'm going to start to drill down now. So just getting into, oh, thank you, Marion. Getting into, I'm not the eligibility clinic. This is just the program model day. So correct me if you need to in the chat if I misstate anything. Oh, and by the way, no disregard for Cleveland. If anybody saw my comment as I stepped into the room, that was actually meant to be a private chat. I was just ribbing my friends in Cleveland who I got hung up with. Okay, so core components. These are some of the common things that I'm seeing around the country in sort of the prevention space as communities are starting to get more organized around prevention. Maybe that started with the emergency rental assistance scramble. Every community had to work to operationalize community access points for rental assistance. Maybe it's building off of that. Maybe it's just a natural outgrowth of your standing up a front door and doing more intentional diversion and problem solving, as I think we've all, naturally just leads to what next kind of discussions. Communities that are starting to move into this space tend to have, as I'm seeing it, common components, or I'm just going to call it core components. And I'm going to push it a step further and say, I believe these are actually core components that any community that's stepping into a more intentional prevention effort should be thinking about if you're doing a systems approach, not just like one program kind of, that happened to get a little bit of ESG dollars. But if you're really looking at a systems approach, I would start with and really make sure you're clear about risk, what risk means, how it's defined, how you screen for it. I'm going to give you an example here in a minute and show you something that might get some wheels turning. I think it naturally involves housing problem solving. As a social worker, I think, and those of us here who are social workers, we all know, we need to provide, our ethos reminds us to provide the least intrusive, support somebody might need and is asking for, right? To really not be too involved more so than we need to. And this is why housing problem solving is such a natural fit for prevention, and that ethos is, it is a light touch. Let me just sort of in a strengths-based way talk about your current housing situation, any other alternatives that might work for you that are safe, that you can stay where you can stay tonight, and talk about what you might do tomorrow and next week to kind of not have to just forestall coming back for shelter in a few days. But that is a natural leading off place also for any prevention program, is to start with the least intrusive intervention and, frankly, the least costly intervention, right? So housing problem solving is a fundamental component of any good prevention program. Lead with that. Have a conversation. What's going on? Let's talk about your situation and see if we can get you connected or help you think through some other options. Shared response referral guidance and referral tools. It's hard to work together with a wide variety of other partner agencies, provider, community agencies, if you're not able to stay on top of the ever-changing universe of resources and program requirements and office hours and so forth and so on. That needs to be centrally managed. I'm talking about not just like a 211 INR, database. I'm talking about prevention focused listing of resources, key contacts, and by that I mean backdoor contacts that can be used in a more urgent situation to expedite access to assistance, and that can be used in terms of the shared response guidance. So no matter who is doing the screening and the problem solving, if it turns out somebody needs shelter tonight, or if it turns out somebody, hey, they're not in need of shelter tonight, but within 2 weeks, their brother says they got to go and they've got nowhere else to go. Having common ways of knowing what to do and say in each of those distinct and definable situations is really important. And that allows us to broaden access to prevention and know when and who to target for more intensive targeted prevention, right? So that's that kind of shared kind of referral protocols, another way to think about it, is really key. Shared training and coordination and having that backbone. So as you're bringing in new staff, and there's always new staff, they're getting trained up on housing problem solving and how to do screening and how to intervene and provide more intensive supports and how to do those kind of priority referrals. If you've got that established, which I would say is another component, is making sure you've got those priority, kind of relationships and protocols established. And we've done this, right? We've done prioritization and coordinated entry for homeless assistance. And now we're talking about doing that for prevention. That's really what these core components reflect, is I think probably everyone is thinking as well as, well, boy, this sounds so familiar. Well, it is, because we've done a lot of this once people become homeless. If you go to the next slide. These are some of the program components. So obviously there's a lot of similarity, right? Programmatically, you want to do some of the same things you're doing at scale, systematically, but making sure your coordinated entry is fully connected. You're as a program, you're fully linked into, coordinated entry and your diversion next steps. And I mean, really quite specifically, if you haven't done this, I would strongly encourage you, even if you're just like, hey, we're the only game in town, we're the only one who gets ESGV for prevention, or we're an SSVF provider, because if you're an SSVF provider, by definition, you're doing targeted prevention, and you should also be connected to the front door. And I mean formally connected to the front door, not just sort of happenstance. Well, what does that mean to be formally connected to the front door? I will just say, I think in my own experience in Columbus, and I'm doing some work, maybe we've got some Sacramento friends on the call today, in Sacramento, is it really boils down to sorting through, for those distinct scenarios, what those triage steps are. And so if you think about like basic workflow through a coordinated entry system, the initial thing you're screening on is, what's this person's situation? Do they need shelter tonight? And obviously, can we do some problem solving to avoid that? Well, in the event that you can avoid that tonight, what are the very specific next things that call center person is going to do, or your access person is going to do? And is that a clear kind of stepwise workflow, so there's no time wasted and there's no batons dropped? And that's really key. And that's what I mean about connected to coordinated entry. You've really thought that through in detail, and ideally it's documented. You've got to document it, and staff can be trained on it. The coordinated entry staff on the one hand, your intake staff or frontline staff on the other hand. Making sure you've got really competent housing search navigation. I want to say one thing, and then I'm going to move off the slide. These last three bullets: housing search and navigation, one-time financial assistance, and housing focused case management. For anybody here who does rapid rehousing, those all sound very familiar, because they are. If you do rapid rehousing, it's exactly the same services. And I think you've heard this before in the office hours, staff saying, just reminding, if you don't already know this, a lot of us know this, is that what you do in the prevention, in the targeted prevention space, is the same thing you do in the rapid rehousing space in terms of housing search and navigation, one-time short-term financial assistance, housing focused case management. The only difference is sometimes somebody doesn't need housing search and navigation assistance. I mean, sometimes people don't need financial assistance either, or even the housing focused case management stabilization. But all those skill sets and services are essentially the same. It's just about where you start with somebody. And what we want to do is start with people while they're still housed, even if precarious and it's super hard and we got to do it so urgently and we got to get, and oftentimes we're going to fail and we're ready to fail, but we're also ready and we're going to do everything first to succeed. Like, let's start moving all the competency and skills and expertise we're developing in the rehousing space just to the edge of our front door and start working our way outward, right? And this is what we're trying to do. These services really are the same. So you can easily, be a program that works in both spaces. In fact, if you're an SSVF program, you do work in both spaces. And I'll bet there's lots of folks on this call, if you are an SSVF provider, who could speak to this better than I could, as far as this kind of, yeah, our staff can go back and forth, but they also know, somebody's either sitting in shelter or out in a camp, or, they're still at their brother's house. And so they understand those differences, but it doesn't really change the nature of what they're doing per se. You go to the next slide. I do want to talk just quickly about some best practices and considerations. And I'm going to kind of skip through some other things. I want to open it up just for more time and Q&A. So I will try to zip through this. And thank you, Erin, for the reminder. So just quickly, a couple of things that I think are really important. I think this mindset, like staff really understanding kind of that but-for mentality. We're really trying to get to the right folks here, and we might not, oftentimes we're not going to see the right folks. We just have to make sure we've got another plan. But just as important as it's critical for staff to understand that the objective is, what can we do to keep you from needing to enter shelter, right? And maybe most of all tonight. And that should be their number one orientation. In Columbus, we switched our front door to a new provider who was a mental health agency, but they operate the mental health system front door, and we thought perfect fit, right? Well, suddenly we had 30 licensed clinicians who were all like trained and ready to say yes. They had a resource, which was access to shelter. And so our diversion numbers went to pot the first few months working with this new partner, because their orientation was, you need shelter. It was less about trying to help somebody from avoiding needing shelter to, I've got a shelter bed, and let me just connect you in, right? And we saw this in our monitoring and our conversation. We had to work on it. That mindset was really critical. It's critical that we've got the ability, staff are comfortable. Talk is housing problem solving, kind of 101, but the staff are comfortable talking with clients about their specific current situation and exploring any and all safe temporary options or permanent options. And I mean, let's talk about all your friends and relatives in the area and who you've stayed with in the past, maybe who you haven't stayed with in the past, you might be willing to consider, and talk about what worked, talk about what didn't work. Like, we got to be comfortable enough to really dive deep on that if we're going to help somebody explore and use a strengths-based model, as Ed Boyd, who's brilliant, Cleveland Mediation Center, now does his own consulting. I'm sure some of you know Ed, just a master in this, always talks about strengths-based, empowerment-focused, approaches that really rely on like what worked for you in the past, right? That's a critical piece. And then using progressive approaches that move from just problem solving again to exploring use of other resources. Maybe we need to help fill up your mom's fridge. Would that help your mom sort of let you stay a little bit longer, knowing you're working with us? Like those types of like segueing into the more progressive strategies, and then having the ability to offer financial assistance. And I want to say this really clearly. For targeted homelessness prevention, I really did not, I probably couldn't have overstated this, the similarity to rapid housing. We have to be ready to offer the maximal amount our funding allows in certain cases, likely exception cases, if that's what it takes to help somebody avoid, once you've engaged them and screened them in, you're providing targeted prevention assistance. If that's what it takes, so they don't immediately, as soon as you go away, need emergency shelter. And that's our number one objective. As soon as you go away, it's not a rug being pulled out. And that person is able to maintain. So that means we have to have those kind of creative, flexible strategies at the ready. And we have to have, again, those next step resources. You go to the next slide. There are a couple different, just to highlight it really quick, outcomes. And I just want to make this one point, which is that success in prevention and diversion does not always mean somebody has a permanent safe home as soon as you're done intervening with them and they're no longer at any risk of homelessness. The number one outcome is to avoid literal homelessness tonight or imminently, and sort of move people away from that precipice. That might mean you're helping them move temporarily, friends or family, for a little while they continue to figure things out, ideally while you're continuing to support and connect them. You go to the next slide. There are a couple things we've learned about targeted prevention. I just want to get in front of you. Engaging people who have lived in housing insecure and have gone through homeless systems and experienced sometimes the indignity, oftentimes the indignity and the trauma of that. These are the folks we need to listen to the most. And in my own work, it's a constant effort to make sure I'm doing that too. So I just want to acknowledge we all have work to do here to make sure we're genuinely, authentically involving people with lived experience in decisions and leadership and the design and service delivery of what we're doing. That's critical. We need to use our data to inform our targeting. As I mentioned, start with the data you have. It's probably not very difficult to pull out of your system just to give you a jumping off point. Where were people staying? But also look at the last zip code where they had a permanent housing. So their zip code of their last permanent housing residence. This is also standard data that every HMIS enrollment is going to have. And of course, the demographic characteristics, because I'll bet you'll see a lot of disparity and inequity in your demographics. And that should also be a really important factor in where and how you target resources to make sure we're first and foremost working against the systemic racism and inequities that cause those disproportionate rates of housing insecurity and homelessness. I mentioned some of these, so I'm not going to repeat. If we go to the next slide, just briefly, I want to give you this example of out of Columbus. This is just some data that shows when you do targeted prevention, it actually can have a measurable effect on your inflow. In Columbus, we had apt associates. When I was back in Columbus, we brought in apt associates to do an evaluation, and they found that the targeted prevention program in Columbus that served families for the fiscal year ending June 19 saw about, well, exactly 176 families avoid entering shelter, which reduced our inflow by about 18% during that period. That was huge. That's huge. Think about, calculate, how many bed nights is that? How many, how much shelter does that take up that we just saved? And by the way, it was roughly 1/3 the cost of sheltering and rehousing somebody to provide them with prevention assistance. Roughly 1/3. If you go to the next slide, the last thing I just want to leave you with, and I believe these slides will be sent around, is just an example out of Columbus. This is the risk typology that Columbus developed to, again, start to set the foundation for screening, for having a common way of talking about homelessness prevention versus other forms of prevention, and to make sure that as a homeless system, we were very clear about like where our lane was. Like, we are concerned with risk level 3. We are every day working to help risk level 4, but we're moving in up the ladder as it were to risk level 3. And we need partners who are also serving folks who are not quite at risk. And so it allowed us to start to organize community resources in a much more intentional way. So if you just skip to the question and answer slide, I think we have some placeholder slides, just background in there. We're going to go ahead and just open it up for a little bit of Q&A. And Erin, can you help me if anything did happen to come through the chat?
Yeah, nothing in the chat so far. I did try to do a little probing question kind of based on the different types and interventions. You mentioned, Tom, whether or not anyone has any examples of what types of homeless prevention interventions they're doing in California.
Right. Anybody want to share just what you're doing?
I'll go ahead and share.
Yeah, please. Yeah.
I don't got much, but first of all, thank you for all the slides, very engaging. Here at Manchester Point Arena, we do have a TDHE, Tribal Designated Housing Entity, that kind of receives some of our dollars and other grant funding in California and HUD. So for homeless prevention, if they're not completely homeless, but they just kind of need some resources, we just been able to tie them into, different housing waiting lists in their area or our housing programs. So really just trying to engage with what's out there and what's available other than actual shelter. Yeah. And that seems to be, a lot of people really don't know a lot of those programs. So although it's not the answer to everything, that's just one example of us trying to use flexible funding elsewhere. So yeah, not too much, but thank you.
No, I love that example. And, I think it just speaks to this need to the way I mentioned, like way back, I started my career in a rural community in Ohio, and I honestly, I think those of you who work in more rural parts of California know you can learn some real fundamentals in rural communities and operationalize stuff a lot easier than it is in bigger urban communities with a lot more providers in the pool. And one of the things I learned early, as I think you're kind of speaking to, Natalie, is just the need to constantly share information. So you've got that readily available, and whoever's kind of, the first to engage a family or individual can get them connected to the right place. And I think that's just a hard thing to do. In Portage County, where I got my teeth, we had what we simply called an emergency assistance network that met every quarter. It was, supervisors and caseworkers, and I think it was a brown bag lunch or something. And then one agency took responsibility to be the secretary, and they issued a newsletter from that. And the whole meeting was just updates. It was just like verbal updates. Somebody took notes and pushed out the newsletter. So everybody didn't have to do their own. It was just such an elegant, simple solution. And that's like 30 years old. And I still use that because it's like, well, that's just like, sometimes it's just about information. So anyway, thank you for sharing that. Veronica, sometimes the diversity provided in rural can be problematic, especially during COVID when they're at max capacity. We still have funding to do more. That's a great point, Veronica. Anybody have a response to that? You have overtaxed providers and maybe funding, but everyone's just maxed out. Has anybody tackled that or have thoughts on that? A lot of experts on the call here.
I'll just share with the Northern Circle, our TDHE, they have maxed out in several different tribes that they're working with. So although we do have an avenue for them to refer to most of those programs in home keys and project room keys, they are at max capacity, or they've obligated the funding out, which is pretty problematic. But again, just trying to keep focused on any type of funding and collaboration we can do, any referrals we can do. But yes, we are seeing that, especially in our rural area. Most of our agencies are tapped out and they're at full max capacity. But with us, we're in the process of seeing about how they can refer to our program as well. So definitely seeing that in the rural communities. Thank you.
Yeah, no, thanks for that. And I see, Aaron, your comment about COC, where you're at, integrating HP has been a struggle, but then and then difficult to have providers adopt prevention practices. I'll just say been doing this a long time, as many of us have. I think it's a long slog, but I do feel there's momentum growing around prevention. I'll say the U.S. Interagency Council is at the National Alliance Conference this week. Some of you might have gone to. I was just there for a bit. But I heard Jeff Olivet, who's the new head of the U.S. Interagency Council on Homelessness, say very clearly, prevention, crisis services, rehousing supports, 3 legs on the stool. And I expect more to come from USICH. And I know we're all like thinking about this, but we do have capacity issues at the same time. So I would just build on Aaron's comment too, and Veronica, I think where you're going a little bit. Yeah, it's hard to find capacity. Sometimes I think we should consider building on kind of the provider platforms we have. Again, diversion, any provider is already doing diversion. It would be an easy, at least programmatic stretch to, extend to also do targeted prevention, to do more than just like one-off problem solving. But I realize too, there's staffing issues, and simple issues like that are a challenge. Any other thoughts? I know we're just about at time. Any final thoughts? Really, we're at time. Or Aaron or Contia, anybody else have final words? All right, well, that's okay. All right. Well, thank you all for just sticking it out. I know a lot of folks are starting to hop off. Aaron, I'm just going to pass it to you to wrap it up.
LaQuantia, I'm going to pass it to you to wrap it up.
LaQuantia, sorry.
No,
It's okay. Thank you so much, Tom, for today. And thank you everyone for your questions. Remember, if you do have more questions,